If you haven't been to the dentist lately, and you should have, you probably have no idea how things have changed as modern dentistry progresses. Dr. Frank Hernandez updates us on the latest technology.
What is interesting about dentistry is that you can hear dentists advertise that they are state of the art. And you know, really your dentist this is what it is right here. You know, you got good hands or you don't. You know, that's your dentist. But there's a lot of things that can happen, you know, as far as equipment that make a more pleasant experience these days. We have digital radiography, we have intraoral cameras, we have abrasion techniques where this little particle of sand comes out and makes a hole in your tooth. You know, there's lasers, but you know, and some of these things are nice on that, but you know what it ultimately comes down to is the hands of your dentist. You know, if he's got good hands, he or she has good hands, that's it. That's your state-of-the-art dentistry. The field of dentistry is more closely related to other forms of medical practice, and I think that patients today are employing their dentist as part of their health team more than they used to. And I think that is a big part of this information age, that dentists are more informed than what we used to be. I think that there is a wide spectrum as to why people come to the dentist. They want a nicer smile, they're in chronic pain, and I think that your dentist has a lot more answers than what he used to, rather than just, he can still fix that little chip. He can still put that crown on that we need to replace the filling and do some of these routine dental procedures, make your smile nicer. But the dentist has a lot more important role as far as your medical health. If you find that a person has a lot of issues with their mouth, a lot of missing teeth, a lot of decay, a lot of these periodontal situations, you're going to see the health of that person more compromised. And I think that the dentist has more of a job today as far as making these connections and referring these patients to the proper physicians. We need to go to the dentist on a regular basis. We need to be checked by your regular physician. We need to do these things. This is something that needs to be done. And the dentist we have a lot of equipment these days that we can get over these phobias and these fears, these dental fears that come up they're not there anymore. I think the dentists these days are more equipped to deal with that concept of pain than we ever have. We have equipment, we have techniques. We're using things that we've never used before. They use hypnosis, they use more calming type of dialogue. We're mentally preparing the patient to deal with these fears. We're taking care of these things these days.
He was wonderful. I had very, very bad experiences at a dentist at a young age. When I finally did get my teeth worked on 2 weeks straight in a row, very, very, very bad experience. Dr. Hernandez, now I love coming here. I have no fear at all. In fact, I look forward to it.
He's very gentle. He lets you know when he's going to do whatever procedure. And I've never really been uncomfortable as far as pain.
From my perspective, as far as pain, that's not really an issue in today's dentistry. If you take care of things properly, deal with infection, take care of the patient in those proper order, you're not going to deal with pain with dental procedures. It's just not happening. The dentist can clean your teeth. Most offices have a registered dental hygienist that is licensed in the state of California to clean your teeth, and he or she is up on the latest things, because that's a specialty of dentistry in its own right, I think. And that is, as long as you are up on your education, there's new things coming across that they're finding all the time, that the mouth has this, the mouth has that, these germs have these things, this bacteria is now resistant to antibiotics. the hygienist is up on that, and they're a specialty, like I said, in their own right. That's the person that you need to see on a regular basis as well.
I've been a patient of Dr. Hernandez for 12 years. And the reason I keep coming back is because he is not only a dentist, but he treats you like a friend that he really cares about, takes an interest in you and your family. And personally and professionally, he just has a very nice atmosphere in his office.